I'm also seeing our syringe exchange numbers go down because people are not injecting clients or even telling us the reason is because people are smoking and using fentanyl.
At this month's local Public Safety Coordinating Council meeting, Tanya Phillips, Jackson County's Health Promotion Program Manager, looks at the alarming overdose data captured by the county's overdose surveillance and alerting system, developed in 2018 to help identify trends and issue real-time alerts with the hope of saving lives.
So looking at 2021, we issued our first alert. This alert lasted just a few weeks. So typically I would say our alerts really do last anywhere from 2 weeks to 4 weeks. So during this time, there were no fatalities from synthetic opioids. So then we issued our second overdose alert on February 28th. This alert has remained in place since then. So it's been 8 months. This is our longest overdose alert. During this whole time, we have had the record number of hospitalization, first responder for their responses, and then also deaths. So again, to have 2 alerts, but then have our last one still in place has been impactful. I've been a part of a group looking at Measure 110 for some assessments, and one of the concerns that I did raise was looking at Measure 110 and doing an assessment on how this may be influencing our overdoses, but also just the drug trends and making things such as fentanyl, which is what we're seeing majority of, if it has influenced any of that. So far through week 42 of the year, we have had a total of 172 responses to synthetic opioids. The responses for law enforcement has increased, had a 4-fold increase from 2020 to 2021. We're averaging about 4 responses per week compared to 2020, where there was just averaging about 1 per week. Definitely pay attention as we go through these graphs, looking at week 26 for most, and then also week 36. So you'll definitely see the trends match between the different agencies. So in 2021, so far, Mercy Flights has had a total of 141 responses, where Narcan was identified as an intervention and the person required to be transported to the hospital for further care. In 2020, we had a total of 153. So far we are unfortunately on par to surpass last year's record. So far, we're averaging about 3.4 responses per week. So we're expected to see around 175 responses just from Mercy Flights. So overall, we have had so far this year 169 overdoses where someone was admitted to the emergency department related to synthetic opioids. This year, we've averaged about 4 admissions per week, so very similar to what law enforcement is seeing. In 2020, we averaged 1.7 admissions per week, and in 2019, it was 2.2 per week. And so really looking at from 2020 to 2021, this is a 2-fold increase. And so again, you see that week 26 and also week 36 all mirror each other within the system. So overall, there were 86 admits for a heroin overdose, and then 97 under the other opioid overdose. And then there were 51 mentions of fentanyl that were specifically identified in the chart notes of the individual saying that is what they use. And that's something very different this year than what I've seen in the past. So the route of drug use is really an important factor, especially when it comes to harm reduction. We know that injection drug use carries the riskiest of them all, just with the spread of HIV, Hep C, other infections, and then the risk of overdosing. Smoking, typically in the world of harm reduction, is a less riskier way to use drugs. If we can get someone from injecting to then smoking, that's a good thing. There's just less risk of infections, less risk of overdosing. Unfortunately, what I'm seeing with the data, though, is when it comes to fentanyl, the risk of overdosing, whether it be non-fatal and or fatal, the risk is still there. It does not eliminate it by any means. And so I'm just finding it's not much safer right now. And so also there was a recent study coming out of San Francisco that also noted that they're starting to see less people injecting drugs, especially if they're using fentanyl. So they are seeing more people smoke. So again, that's a different trend as we start to see more fentanyl and pills come through our area. I am seeing that trend change. I'm also seeing our syringe exchange numbers go down because people are not injecting. Clients are even telling us the reason is because people are smoking and using fentanyl. The average age of the overdoses was 35 years old. The minimum was 15, and the oldest was 77 years. And then the majority of the emergency department admissions were males. Currently in 2021, we have 43 fatalities related to synthetic opioids. Some of these are confirmed cases, some of are presumptive, and some are still suspects. We're really averaging right now about 4.3 deaths per month. So far for the year, we've had 20 deaths related to heroin and or 25 related from fentanyl. So average age is 38, minimum has been 17 years old, and then the maximum so far has been 66 years old. Looking at sex or gender, majority of the deaths are among males, with 76 of the fatalities being males and 24 of the fatalities being females. So again, very similar to what we see with hospitalizations.